So at this time, Dr. Antoine Trammell, who is officially and unofficially, really, the co-director of our Outreach Recruitment and Engagement Corps. He is the Georgia Memory Net provider who does cognitive assessments for people who are referred outside, well, Metro Atlanta, pretty much. He's part of the 8 different memory assessment centers that your tax dollars pay for. He leads the one that's here in Atlanta. And Dr. Alvin Griffin is a physician who has been practicing at Morehouse School of Medicine and has operated his own family medicine practice in Conyers. So, Dr. Trammell, Dr. Griffin.
Good morning, guys. I took a few notes. About the feedback that I heard, the words, the terms that I heard you mention. Loss of independence, facing your mortality. What are our priorities? Needing to know who to talk to, advocacy, clinical trial underrepresentation, telling the younger generation we need to do it now, being scared about what you might find out. You've probably heard that expression many times. I'm not going to claim it. Reducing stigma about research because of what happened with Tuskegee. Let me say a little bit more about that. In some ways, saying that minority populations don't participate in research because of Tuskegee can be like victim blaming. What we have found out from looking at data from over 40,000 people at Alzheimer's centers around the country is that people from minority backgrounds simply are not asked. They're not referred. The opportunity may not be presented to you. So the opportunity is there. The door is open. There's a song, the door is wide open for you, the door is wide open for me, right? I think it's from the OJ's, Stairway to Heaven. So here we go, climbing our stairway to heaven. We need to reduce stigma. Sorry, I just mentioned that. Misconceptions, crazy. You want to hear the Richard Pryor? Okay. His comedy, as I listen to it more and more, it really isn't comedy. It's social commentary. And I remember, one of his jokes was about the numbers man. And he said he could take the numbers and they need pencil or paper. Now he doesn't know who he is. Thinking, I think he's talking about dementia. But he's describing it in a language that we know, that reflects our lived experience. And that's important. Your lived experience, because it's your life, has to be taken into account. That can inform and guide your care, your research. More education, more experience with data. Like, what do we do? Again, that's the value of lived experience. Knowing how to diagnose and treat disease in people from diverse backgrounds is important, right? Because ultimately, Alzheimer's, whatever disease can cause memory issues and dementia, doesn't care what you look like, what race you are, it can affect you. But we need to know how to address it and how to maintain our communities across the board, support our community, and more time for these discussions. And next point, we were just looking at numbers from this program. In 2015, we had a total of 5, like Dave Chappelle fifth, 5 men in 2015. By 2020, there were 36. By 2024, 163 African American men. Well, yes, give yourselves a round of applause. That's right. And you know what else? 126 of that 163 were participating in research. So more than three quarters of you decided to participate in research so that we can learn more. That's your voice, right? A few more points, and I want Dr. Griffin to talk. Earlier, Dr. Parker said something important. It really spoke to me. That in a lot of cases, our wives, women in our lives, will drag us to health appointments. Fellas, we need to support our women too. Let me ask y'all, what is the sign of a heart attack in a woman? Just tell me one sign. Sign of a heart attack in a woman. Stomach pain, jaw pain, chest pain, shortness of breath. Okay. All right. So, chest pain, shoulder pain, jaw pain, that was described in middle aged white males, right? Number one sign of a heart attack in women is being tired, fatigue, right? How many of you have wives or daughters? Most of you. For the women in the room, if you have families or a husband, and if you have parents and you're taking care of them, how many of you are tired? Yeah. Almost all of them raise their hand, guys. See the problem? We can miss it. So we have to support them as they support us because without them, we are only half of a community. Something else. It's well known and it's published in a lot of papers, but it may not be talked about. There's something called the Superwoman Scheme or Superwoman Schema. Refers to black women. You ever heard of that? Okay. So black women, they like to be superwoman and they take on a lot and they ignore their health and well-being. Look, I want to enjoy my life as I age and I want to enjoy it with the woman in my life. And I want you to do the same thing. Right? So let's support them as they support us. So let's shift now to our our conversation. Dr. Griffin is in my one of my clinical trials. I also evaluated him in clinic because if you're in a clinical trial and you're not benefiting from current clinical care, that's a problem to me. So we need both. And I spoke to Dr. Griffin about that, and he's like, "Yeah." So, you know, he came, we had a conversation, we did the clinical evaluation. And the point is that participating in research is only one half of the coin. To truly empower yourself, which is my goal, to empower people to maintain their quality of life by giving them information that will allow them to make a decision, to go ahead and claim it and to act, you can spend your time. You can prevent yourself from becoming that crazy person that you may have, seen growing up as a child. When I say, or someone says Alzheimer's, we typically, what comes to mind is a person who doesn't know who they are, not functional. But we need to change the face of that because that's not what Alzheimer's looks like. Alzheimer's is a diagnosis. High blood pressure is a diagnosis. It's a condition, a health condition that's treatable. Just because you have high blood pressure doesn't mean you're going to have a heart attack or a stroke or kidney failure. Just because you have Alzheimer's doesn't mean you're going to go down that road and become demented and not knowing who you are if you act early. The bulk of treatment is lifestyle, what you do and how you're doing it. The drugs complement it. So, to that point, Dr. Griffin came to me after I shared with him his diagnosis. of Alzheimer's disease. He wanted to have this conversation. He wants to address you. And I believe it's his medical background that allows him to understand what people may feel as patients and why it's important to have the conversation. Doctor.
Thank you for having me. Um, just one point I like to mention. Um, Dr. Park and I went to school together. Want to say she was one of the smartest persons I've ever met, and we were intimidated by her in school, and we're still intimidated by her. But anyway, I do have a family history of back then. We used to say they're crazy, or they have lost their mind, they have memory problems or whatever. Now we've got diagnoses that go along with that, those type of illnesses. And I've had a sister that had Alzheimer's disease, and her husband, and both of them were in the medical field. And he would sometimes make fun of the fact that you just asked me that. And I know some of you all have heard that expression when somebody asks them the same question over and over again. And I tried to explain to him, who was in the medical field, I said, she's not aware that she just asked you that. I said, but it's going to hurt you to answer the question again. I said, because what's going to happen, she's going to feel bad about asking questions. And she's going to be going through her mind, did I just ask that question? I don't want to feel stupid, so I'm not going to ask it again. And that may be something that you really, really, really need to know. So if you've had that experience, please go back and share that with them to say, please, it's okay for you to ask the question as many times as you want to, because I'm here for you. Believe me, they will probably stop asking you that question after you present it that way, because they're unaware that they have asked that question. My background is in family medicine. I've been a family practitioner for over 34 years here in Atlanta. I was on the faculty at Morehouse School of Medicine. And then I went in private practice, but I just recently made the decision to semi-retire. I'm still the medical director of the Department of Juvenile Justice. So these kids that you see on TV, I'm the one that's doing their physicals on when they come in. And I ask them a lot of times, I said, why did you do that? Why are you here? They said, well, I just needed a ride. I said, and you know that was stupid. I said, now what if someone took your mother's car and that was the only transportation she's had to get you and back and forth to school or to work? Wouldn't you feel bad? Yeah, I never thought of it that way. So I'm that person that you see these kids on TV. I'm the one that's doing their physicals and providing their health care in the city of Atlanta and in the DeKalb County.
Guys, take this in. So Dr. Griffin is here talking to you. He has Alzheimer's disease. He knows who he is, where he is, how he got here, where he's going, what he's going to do tonight, and he's telling stories. He's still working, right? You understand that? Exactly. It's possible, and we need to make it common. Go ahead.
Well, he's really putting the I guess the lemon on the cake right now, but but anyway, I love the compliment. But anyway, if you have experienced someone with these problems and you start to notice these things, have a conversation with them, and to the point that you understand what they're going through, and not in a derogatory way, and to make them feel bad or ashamed of what's going on. One of the things you can do is create a list of things that they do on a daily basis that you've noticed, or things they need to do on a daily basis. You have no idea what that would do to that person, to realize that someone is understanding what they are going through, because most of the patients that I've encountered, they actually shut down on you. But in their mind, they've gone through these questions several times before they even ask you that question. And it may be something that you may need to know that particular day or that particular time, that they may not even address you with that. So don't look at it as a derogatory type of situation. Look at it as, I'm here for you. type of situation so we can basically maneuver through this path together and we'll both be successful at this situation. You know.
Keyword is together. No, I couldn't do what I do without people like Dr. Griffin, right? He came early, and because we caught it early, his future is it's up to him. Sorry about that. That's just my phone. Don't worry about it. It'll be okay. And that's important. Together and acting early. So how many of you want a good future? Okay, good, good. All right. So, all right, we're there. So then, what's stopping you from acting early? Like, why should there be a stigma to taking care of yourself, to maintaining your health? I know that socially, people face a lot of difficult circumstances. Probably, some of you have seen some things in life that no one should see that have been tough, but it's in the past. We overcame it and we're here to do something about it such that it doesn't happen again in the future, right? So if you made it through all of that, just I'm talking to him, a black man. I just want you to think about something, okay? So my oldest ancestor was in this country in 1775, before the Constitution, right? So it took less than 100 years between the Constitution being written and slavery being abolished. That's a very rapid change, right? So there's a lot of progress that's possible, but the people who came before us survived and endured. So do you think they put in all that work for you to say, well, you know what? I just don't want to know. I'm not going to claim it. I don't think so. I don't think so at all. What questions do you have? Because this is really a moment for you to see what Alzheimer's can look like and what you can do if you act early. Yes,
Yes,
sir.
yes. You. Mhm.
You don't have to be quick.
Well played, well played, well played, well played.
Okay.
one of the things that I've discovered, because I am in medicine, I'm able to recognize things probably much more quicker than most average person is having. And with a family history of this, I had to question myself, am I in that category? I mean, there were 6 of us, 3 have it and 3 don't, but you don't know which one it is. And I remember when I was in medical school, the doctor came in there, gave a lecture. He said, I got good news and bad news. He said, 90% of you will be fine. He said, but the bad news that we don't know which 90% is, you know, you know. So my thing is that I had to come with some realization of myself as far as, is this what's really happening, to me that I've seen before? And I had to identify the fact that when you bring it out earlier, it actually lets you live a more productive life longer because you weren't trying to conceal it or hide it from anybody. I mean, it's good to have the list that you don't have to remember every day as far as what you have to take or what things or that you have to do or directions you have to do. And you've got people who have those faculties still take that responsibility away from you and help you along with certain things so you don't be struggling with that all day and all night by yourself. Did I do this or did I do that? Even, like I said, my mother was 84 pounds and she asked me, did I eat? And I said, no, even though she had eaten a meal, I gave it to her again, and when she passed away, she weighed 116 pounds, so little subtle things that you can do to try to help your loved one and let them know I'm here for you, and let them know that if they did ask the question before or did a task or whatever, as long as they're not hurting themselves, let them know you just asked me that. However, ask me again if you feel you need to ask me that. And believe me, you'll see that number start to go down and down and down, and they'll feel more comfortable opening up with you about a whole lot of other things that you were not aware of, believe me.
When it comes to truth, I have an expression that the test of truth is experience. So speaking to a person's experience can speak to their truth. And understanding and acknowledging their experience can help them and reshape their perception of what is truth. A few years ago, I showed a map, well, 2 maps, and I overlaid them. So one was a census map from the year 1860. The darker areas were slaveholding areas within the Southeast. Then I overlaid it with a map from, I think, 2014 or 2016 that show regions of high mortality in the country, and they're almost mirror images of one another, right? So that speaks to social experience that became someone's, our truth, okay? But as our experience changes, so can our truth. Okay. I think this gentleman yes, sir.
Are. And in both cases, they ended up with different forms of dementia. And now, as I'm approaching their ages, one was 92 and the other was 98, my concern is, how do I prepare for these situations? We typically prepare for elder care and so forth because of disease, but we don't do much planning in terms of people having dementia and being cared for with dignity. So I'd appreciate your thoughts on it, since you are faced with that, because this is a question that plagues me as I, revise my will and medical directives and so forth.
Very good question, and I'm glad we're having this discussion because it's one is somewhat taboo in our community. but it's real. And once we realize that, there's so much help that's out there that you don't know about. And even being a physician, there's so much information that I was unaware about, and I was reached out and got resources to help me and my family move forward. Um, and so the point is that um, be honest with yourself. That's the main thing. And try not to be embarrassed about things that you really need to know that may help you. And so often we still trying to be a proud Black man or whatever. That can't happen to me because I'm the household, money giver or whatever. And but sometimes, you get older and things happen to you. And I still drive, I still work, I'm still functioning, but certain things I know what my basically categories are that I can't do anymore. I mean, you can still go out and be intimate. I know that's what y'all concerned about, you know. So don't let that deter you in any way. And actually, some of the medicines for that can help that situation because of blood flow going to the brain, you know. So so my thing is that you have to be honest with yourself. And when you start noticing any of these subtle type of things, ask yourself or others, have they noticed these things about you? Because they might say, yeah, I've been noticing a long time, but I was afraid to say something to you because of how your personality may be. But again, if you take anything away, you have to be honest with yourself about what's normal and what may not be normal to you that you're used to.
So I have a feeling now our doors are going to get beat down since Dr. Griffin said that treatment for memory issues can also help you be intimate. So I'm probably going to get a lot of people asking for spinal taps and other things. Go ahead.
Yeah, the question I had, I had my mom passed when she was 89 from complications to dementia. I have a present sister who has dementia. I have an uncle that died with dementia. And I have a first cousin with dementia. There were a lot of statistics up here in terms of how much higher our incidence of Alzheimer's are in terms of minorities than non-minorities. So my question is that is dementia or Alzheimer's mainly hereditary, or is it something we're doing as a race in terms of our lifestyle and health that's so much different than non-minorities for our percentages of dementia to be so much higher than others?
All right. So is dementia hereditary? Okay. There can be a hereditary component, right? That is risk. Risk is never a guarantee. You've heard us talk about superagers. Some of those people can have Alzheimer's disease, but their memory, their other areas of thinking are perfectly fine. So even if it is hereditary, it's the environment, your social exposures that can modify that risk into disease or not disease, or rapid progression or no rapid progression. To answer your question? Lifestyle, healthcare access, right? There are, all right, let me be a scientist for a second. So Alzheimer's was characterized in well-educated older white adults. So what we know, how it progresses, how it's diagnosed, comes from that population. That makes it easy to misdiagnose it in someone else, right? So understanding how lifestyle, how other things contribute to disease and the diagnosis is critical. So in other words, social factors and lifestyle factor into why we may have a higher risk and incidence of disease.
And we have time for about 2 to 3 more questions before we close out. Yes, go ahead.
Yes, at our table, Dr. Griffith and Dr. Trammell, two things came up, and one was the misconception that memory loss and Alzheimer is inevitable in old people, and sometimes just for old people. So we need to dispel that. Because I shared with them that I had a cousin that failed all the markers and at 59 had early onset of Alzheimer. And then the other thing is sometimes we are slow to recognize the decline. So give us some pointers on that.
Well, now it's a work in progress. There's still a lot of things that we don't know about the disease. And a lot of people say it doesn't happen to me. And if it's some things as far as just memory loss, you're thinking, well, because of your age, your memory wanes. But when there are things that actually that you used to be doing so well, so fine, and all of a sudden you can't do those things now, there may be something a little bit more to that. So I would definitely suggest everyone in here needs to get a complete physical examination and also talk about and make sure your physician talks about that portion of your body as far as your memory and how you're thinking and how do you keep up with things right now as compared to what you used to. And you might say, well, now I have to write things down. That may be an early sign of what may be coming to you later on. And you can actually somewhat stave a lot of those things off if you actually be honest with yourself and be honest with your family members and ask them, say, have you noticed anything different about me or that I used to do back then as compared to doing now? So that's a conversation that you really need to have with your family.
It is absolutely a myth that people become old and senile. You do not have to lose your memory and your thinking abilities as you get older. Okay. Basically, what Dr. Griffin said, act early, act fast. When you go to see your doc, ask them to give you some type of screening for your memory. It's your right, it's your life, it's your health.
Doc, I got a question. And on the aspect of, you touched on the repeated questions that you get from some. Is there a proper way of addressing that person so that you give them the dignity they deserve rather than them, as you mentioned, possibly shutting down?
Right. And one thing you can just reassure them that it's okay if you ask me that question again. Something simple as that, because they may have not remembered that they asked you that question. It may be something that you really, really need to know, and they need to know that to protect their life. You know, so that's how you address it. And if you know you've got people in your family like that, you can engage in the conversation and don't wait on them to engage in it and let them feel secure about what they're asking and how they ask it. If you answer be honest with them. If that's the answer that you want to give, respond the same way that you gave to before. Because if not, they're going to be saying in their mind, you said it this way this time, but this way you saying it a different time. So which one am I going to believe? The third one the time I asked? You know, so be consistent with what you're saying, just so they'll know that you are actually with them. But the main thing is to let them understand, I know you're going through some things. I'm here with you and I'm here for you. We can go through these things together. You'll be surprised how much they will open up to you about a lot of things that you had no clue about.
Doctors Trammell and Griffin, we in the interest of time, we're going to have one more question right now. We see a flurry of hands. Doctors Trammell and Griffin, are you all willing, in respect for your time, once we close, to take, if a couple of gentlemen have questions, can they come ask them? We want to respect your time. Will you stay around a little bit, or do you have time to? We don't want to flood them with questions, but we want them to still offer. Will you be available?
I'm available.
Dr. Parker says yes.
Okay. Dr. Parker. And we know what that means. So the answer is yes. So thank you, Jim. We love the questions and we're going to honor them. But in interest of time, we have one more right now and we're going to close out the program.
Thank you, doctors, for being here. I have a kind of what I'll call a piggyback question. Lately, as I mentioned to my table, there was a program on these bars that are serving non-alcoholic drinks, and they're becoming very popular. And it was mentioned that any kind of alcohol affects your memory. And so a simple fix for that, in my opinion, would be just stop drinking alcohol. But the question I have that I call a piggyback question is that just about every ailment that I see and hear about, they talk about reducing your stress. Question, has there been research to show that stress affects your memory, Alzheimer's, dementia? And if so, what are some of the ways that an older person can reduce the stress that can lead to memory loss?
Great question.
Yes, that's a round of applause question.
I'm gonna get to the perspective of answering it from someone who has some of the symptoms. Then I'll let him talk about the technical portion of it. Okay. Yes, it does affect that. And so, in certain ways to offset that is to write things down or be repetitive in some of the things that you do, so it becomes a part of you. Now, we talk about long-term and short-term memory. And people always ask you, how can you remember stuff you did when you were a child and you can't remember when I asked you just to go to the store and get some milk or something? But the long-term memory, that's the one that stays around. It's the short-term memory is the one that goes and comes and goes and comes. And he can speak on this a little bit more. So that's normal for you to have that, and just let them know that, yeah, you can remember who you played marbles with, years ago, but you can't remember, I told you to bring this from the store when you went, and you don't even have that item, so, but have the discussion with your family members. So it's not an embarrassing thing, because it can actually save someone's life if you actually talk about some of these issues that you are dealing with.
I'm glad you asked. I wrote a paper about it from people right here, volunteers, research volunteers at our Alzheimer's Center. Here's what we found. In Black Americans, they had more stress, and their stress, social stress, actually was associated with higher levels of chemical changes that lead to Alzheimer's disease. So when it comes to stress, it's okay to cut some folks out of your life, right? Cut some folks out of your life. It's okay to cut out the drama. It really, I mean, hey, phones have, you can block numbers in your phone now. Do it. When you wake up, and we talk about things that relate to what we call cognitive resilience, basically how to protect your brain and your memory and your thinking as you get older, right? Having a purpose in life is one of them. And I say before, I come in here and talk to y'all, that's part of my purpose in life. Doing the work that I do, that's part of my purpose in life. Having healthy social connections, and learning resilience. Those are things that we can do to counter stress. So when I have a bad day, I remind myself that my worst day is a dream compared to that of my ancestors, right? Now, drinking. I'm glad you brought that up too. Moderate drinking is okay. Just don't overdo it, because what I found, a paper that Dr. Park and I wrote, where is she? There she is, that Black Americans 80 and older who drank moderately, they did fine. Their memory was great compared to their colleagues who drank heavily, right? Moderation. Of course, you can say something.
One of the things too, this disease has no boundary as far as race, nationality, whatever. It hits all of us. And some of us, it hits worse than others. But if I can just leave one nugget, is that open up to someone who's around you, or several people who are around you who knew you then, know you now, and actually they can actually help you so that this disease doesn't progress to the point that you are non-functional as a human being. And if that's anything that you remember here, just open up to your family members and friends about what's going on with you.